What most accurately predicts your health status? Is it a doctor's diagnosis, or is it your genetic information? In fact, in modern public health, one of the most reliable predictors is said to be your zip code, the place where you live. By 2026, we are confronted with the existence of health barriers that cannot be overcome by individual effort alone. As evidenced by numerous scientific studies, these barriers are systemic. Today, we will unravel the true nature of health inequality. Citing globally trusted papers and reports, we will map the forensic reality of the social body and its impact on longevity. There is a legendary study that cannot be ignored in the study of health inequality. It is the Whitehall study, conducted by Professor Michael Marmot. This study tracked tens of thousands of British civil servants for several decades. The results were astonishing and changed our understanding of health. Even after considering differences in lifestyle habits, such as smoking and diet, a clear correlation was found between status and survival. The lower the job rank, the higher the mortality rate from heart disease. Managers lived longer, healthier lives than their subordinates. In his book, The Status Syndrome, Professor Marmot points out that this is because the lack of authority to control one's own work becomes chronic stress. This lack of discretion destroys the body over time. Health disparities are not simply a matter of poverty, but a biological response to social hierarchies. Next, we will introduce the Black Report, published in 1980. The British government's research was based on a fundamental assumption. They assumed that free healthcare would eliminate health disparities. However, it revealed the opposite reality. Disparities actually widened. This report demonstrated that living conditions are more important than healthcare. The 2010 Marmot Review proposed a life course approach. Early childhood education, living environment, and unstable employment, these factors accumulate to produce illnesses in old age. The impact of a neglected childhood can be difficult to erase, no matter how much awareness is cultivated in adulthood. Social paths are powerful. So, what about Japan? Even in this country with a universal healthcare system, inequality definitely exists and is measurable. Let's look at the results of the JAGS, the largest scale survey in Japan. The data indicates that groups with lower income are more likely to lose teeth. Particularly noteworthy is social capital, or community connections. Even with low income, people in active communities tend to have better health. This suggests that community can potentially compensate for flaws in social structure, but also highlights the reality of those deprived of such connections. The Whitehall Study, the Black Report, and Japan's JGES. This vast amount of evidence all agrees. Health cannot be left solely to individual effort. What is truly needed is not individual mindset changes. As the WHO recommends, we need health in all policies. Everything from housing to transport is healthcare. Evidence serves as a map to where we need to improve. Challenging the structure of inequality, that is the true mission of public health in 2026. Thank you for joining us. Join us next time as we continue to map the future of health through science and evidence.